All right. Which of the following findings in their offspring would be most suggestive of a carrier state of alpha thalassemia? So they're asking for this is like a hereditary question. Um, Alpha thalassemia, if I remember correctly, it was an X-linked X-linked condition. So a pregnant woman undergoes routine prenatal screening. She of Southeast Asian descent and has no significant medical history. Hemoglobin levels slightly lower than normal, otherwise asymptomatic. Partner who's also Southeast Asian descent has a normal hemoglobin level, which the following findings we most suggested of carrier state. Okay, hemolysis and jaundice. I don't know. Even though I said that, like, okay, they're asking this kind of question, I kind of don't know where it's going so far. So I'm just gonna go to
Sure.
the choices. Hemolysis and jaundice, microcytic hypochromic anemia, normal hemoglobin levels, severe anemia requiring blood transfusion, sickle cell, or red blood cells. Okay, so which one is suggestive carrier state? So it's not sickle cell. I don't think they're related at all. Severe anemia. Okay, so wait, sorry. The question is asking what is indicating this patient is a carrier for alpha thalassemia, right?
Yeah.
And so it would
So I guess the
be
question is, what does that mean when you talk about carrier versus, not carrier? What give me an example of somebody that has a carrier of something. What does that mean in genetics, I guess?
so they have the mutant gene or
Yeah.
they
So
have the allele for it.
yeah, so you have to think of it like this, right? So anybody that's a carrier, giving you an example, right? It means they carry one mutant allele, but not necessarily the disease state. Does it make sense?
Hmm.
So
Okay, so they're a carrier, but they don't exactly have it.
okay. So
It
what do you
would
want to pick?
be uh, a normal hemoglobin level since they don't have it.
Okay, final answer.
Yeah.
Okay, let's talk about. I mean, that's what I would have picked. I would have picked normal hemoglobin as a carrier state. But let's figure out kind of what kind of they're going through here. Microcytic hyperchromic anemia, thalassemia, genetic alpha leads to imbalance of alpha and beta, results of abnormal hemoglobin microcytic anemia and carrier states for alpha thalassemia. Offspring would have a mild form of the disease, typically presenting with microcytic um, hypochromic anemia. Okay, so would be section, it would not be section for us as typically. Oh, okay. So this is something I learned new. Okay, so alpha thalassemia, if you remember correctly, there's like multiple alpha chains, right? It
Yeah.
seems like even if you're a carrier, you're gonna have some anemia, not a lot, but some anemia. So you're not gonna have hemolysis. It's because do you remember your thalassemias by any chance? There's beta and alpha.
Yeah, I know beta and alpha. I don't know all the separate
Sure,
distinct
sure.
between.
So alpha, I always remember alpha as an Asian. It usually happens in Southeast Asian descent. It's going to be a microcytic anemia, especially if you're full blown, right? I think I want to say there's four types. Let's see, hold on. Types of alpha thalassemia. Four types: silent carrier, alpha trait, HH, and fetal hydrops. Yeah, so there's four different types. Okay, and they deal with severity. So silent carrier is like you don't really have bad symptoms. You might have mild anemia, which is the one they're testing on. Alpha thalassemia trait is a little bit worse. Okay, and then HBH disease is very very bad, right? And then those that have like four alpha chains that are bad, they're gonna die practically in utero. Okay. So in this case, right, patient is a carrier, so the most mild form, so still has a little bit of microcytic anemia. Okay. You're not going to have hemolysis and jaundice, right? That's usually due to some kind of infection, right? Autoimmune disorder that kills your red blood cells. So that's not going to be the case. I think C is a great answer here, especially if you're like, oh, I'm not sure, right? Carriers usually don't show a phenotype. So C is not a horrible answer. And then severe anemia, like I said, that's probably like the HBH type. So a little bit more severe in alpha, and then sickle shaped red blood cells. That's sickle cell anemia. That's not alpha thalassemia. So
Yeah.
best answer is going to be B here.
Okay.
All right, but I think you worked through that pretty good. All right, let's